Welcome to this week's edition of Women's Health Updates, covering the latest breakthroughs. Brought to you by LucidQuest. Daré Bioscience and Rosy Wellness have launched a campaign for a first-of-its-kind prescription topical sildenafil cream designed to enhance blood flow and sexual response in women. This collaboration offers educational content, including short-form quickies videos and in-depth collections, aimed at combating misinformation about female sexual health. The cream is expected to launch in the United States in the fourth quarter of 2025 under FDA Section 503B compounding rules. Reports indicate that presidential candidate Robert F. Kennedy Jr. plans to overhaul the U.S. Preventive Services Task Force, potentially removing all 16 members for being too woke. Experts warn that such changes could jeopardize HIV prevention recommendations for Gilead's Descovy and GSK's Apretude, and indirectly affect the twice-yearly HIV prevention drug Yeytuo. The U.S. Food and Drug Administration has extended its review of Bayer's Elinzanetant, a novel menopause hot flash treatment, by up to 90 days, citing no safety or approval concerns. Elinzanetant is the first dual NK1 and NK3 receptor antagonist for hormone-free menopause symptom relief. It is already approved in the United Kingdom and Canada, with reviews pending in Europe and other markets. The European Medicines Agency has recommended approval for Yeytuo, a twice-yearly lenacapavir-based injection for HIV prevention. Clinical trials, Purpose 1 and 2, showed near-zero HIV infections in Yeytuo participants compared to those taking daily Truvada, with significantly higher adherence. The EMA's accelerated review involved the World Health Organization and regulatory agencies from Africa and Asia. In a world first, the United Kingdom's National Health Service is rolling out a gonorrhea vaccine program using the 4C-Men-B vaccine. Offered to high-risk individuals in sexual health clinics, it is expected to prevent up to 100,000 cases over the next decade, saving an estimated £7.9 million. The program aims to combat antibiotic-resistant strains of gonorrhea. Meta has been found liable for misusing reproductive health data from the Flow Health app to target advertisements. A California jury ruled the company violated privacy and medical confidentiality laws, with a class action covering 38 million women. Damages could reach $190 billion. The case underscores ongoing reproductive health privacy concerns following the reversal of Roe v. Wade. Noom has launched a low-dose, more affordable alternative to Wegovy, offering a 0.6 milligram semaglutide dose to improve accessibility and reduce side effects. This move adds competition to the obesity drug market, currently led by Novo Nordisk and Eli Lilly. However, the FDA warns that large-scale compounding could violate rules that apply once drug shortages ease. Celcuity's investigational therapy, gedatolisib, has delivered historic Phase 3 results in advanced breast cancer. In patients with HR-positive, HER2-negative, PIK3CA wild-type disease, treatment regimens reduce the risk of disease progression by up to 76%. Median progression-free survival improvements of 7.3 and 5.4 months surpass all previous Phase 3 results in this setting. The company plans to submit a new drug application to the FDA in the fourth quarter of 2025. The Bill and Melinda Gates Foundation has pledged $2.5 billion to women's health research. The funding will support over 40 innovations across maternal health, menstrual health, contraception, sexually transmitted infections, and gynecological care, with a focus on low and middle-income countries. The foundation is urging governments and the private sector to match its investment. Stay ahead in women's health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.